Combating Medicare and Medicaid Program Fraud, Waste, and Abuse, FWA, Annual Review. Completed the annual review of the Combating Medicare and Medicaid Program Fraud, Waste, and Abuse, FWA, training in accordance with the Centers for Medicare and Medicaid Services, CMS, program's training presentation. The training addressed the identification, prevention, reporting, and compliance requirements related to fraud, waste, and abuse in Medicare and Medicaid programs. Emphasis was placed on recognizing potential violations, understanding legal and ethical responsibilities, and maintaining compliance with CMS regulations to protect program integrity and ensure appropriate delivery of healthcare services. Reviewed by Dr. J.G. Padin, MPH. Understanding the course objectives related to fraud, waste, and abuse (FWA) is essential for maintaining compliance with Medicare Part C and D requirements and protecting the integrity of healthcare programs. By learning to recognize FWA, individuals can identify improper practices that may compromise patient care or misuse Medicare funds. Knowledge of the laws and regulations governing FWA helps ensure adherence to federal requirements and ethical standards. Understanding the potential consequences and penalties associated with violations reinforces accountability and the importance of compliance. Additionally, learning effective methods to prevent, report, and correct FWA empowers healthcare professionals to take proactive measures that reduce risk, support organizational integrity, and promote the responsible use of healthcare resources. Together, these objectives help foster a culture of compliance, transparency, and high-quality patient care. Fraud, waste, and abuse are actions that misuse Medicare resources and increase healthcare costs. Fraud is intentional deception for personal gain, waste is the unnecessary use of resources, and abuse involves practices that do not follow accepted healthcare, business, or financial standards. Understanding FWA helps protect Medicare and promote ethical, compliant care. Medicare Part C, Medicare Advantage, provides healthcare coverage through Medicare-approved private health plans, while Part D provides prescription drug coverage. CMS requires all participants to help prevent, detect, and report fraud, waste, and abuse. Examples of fraud: fraud involves intentional deception for financial or personal gain. Common examples include billing Medicare for services not provided, submitting false claims, falsifying medical records, using another person's Medicare information, and engaging in prescription drug diversion or theft. Examples of waste and abuse: waste and abuse occur when healthcare resources are used improperly or inefficiently. Examples include ordering unnecessary services, duplicate billing, excessive use of medical resources, poor documentation practices, and prescribing medications that are not medically necessary. Exercise, think and answer. Question 1. An RBT documents that a child received a full 4-hour ABA therapy session. However, the child left after only 2 hours due to illness, and the therapist submits documentation for the entire 4 hours. What is this an example of? A. Appropriate documentation because the session was scheduled for 4 hours. B. Medicaid fraud because services were billed that were not provided. C. Acceptable if the supervisor approves it. D. Only poor documentation, not fraud. Correct answer. Here's the reasoning. Question 1. Scenario: an RBT bills for a 4-hour session when the child actually received only 2 hours. Correct answer: B. Medicaid fraud because services were billed that were not provided. Why? Medicaid only pays for services that were delivered. Billing for 4 hours when only 2 hours were provided is a false claim. This is commonly referred to as overbilling or billing for services not rendered. If done knowingly, it constitutes fraud. Identify how to report FWA. Understand the appropriate channels and procedures for reporting suspected fraud, waste, or abuse, including compliance hotlines, supervisors, and CMS reporting mechanisms. Consequences and penalties. Violations involving fraud, waste, and abuse can result in serious consequences, including financial penalties, repayment of funds, exclusion from Medicare programs, loss of professional licenses, termination of employment, and potential civil or criminal prosecution. Preventing fraud, waste, and abuse requires following policies and procedures, maintaining accurate records, completing compliance training, monitoring for suspicious activities, and protecting beneficiary information. Recognize how to correct FWA. Learn the steps necessary to address identified issues, implement corrective actions, prevent recurrence, and ensure ongoing compliance with Medicare requirements. Correcting fraud, waste, and abuse, FWA, is a critical component of maintaining compliance and protecting the integrity of the Medicare program. Organizations and individuals must promptly identify and investigate potential FWA concerns to determine their cause and scope. When issues are confirmed, appropriate corrective action plans should be implemented to address deficiencies and prevent future occurrences. Any identified overpayments must be reported and repaid in accordance with CMS requirements. Additionally, ongoing education, training, and monitoring should be provided to ensure staff understand compliance expectations and consistently adhere to established policies and procedures. These efforts help promote accountability, reduce risk, and support the delivery of high-quality, ethical healthcare services. Key takeaways: preventing fraud, waste, and abuse, FWA, is a shared responsibility that requires vigilance, integrity, and compliance with Medicare regulations. Understanding applicable laws and reporting requirements, promptly reporting suspected violations, and consistently promoting ethical and compliant practices are essential to protecting program integrity and ensuring quality healthcare services. If you suspect Medicaid fraud, report it through your organization's compliance process by notifying your supervisor, if appropriate, compliance officer, or compliance hotline. Provide only factual information, such as the date, individuals involved, and a description of the concern. If the issue is not addressed or involves the organization, report it to your state's Medicaid Fraud Control Unit, MFCU, or Medicaid agency. Reports are typically confidential, and employees who report concerns in good faith are generally protected from retaliation. Also can call 800-HHS-TIPS 1-800-447-8477. This presentation was revised and created under copyrights by Dr. J.G. Padin, MPH.